Mainland China has marked a milestone in the fight against the coronavirus. For the first time since the outbreak began, no new deaths have been reported. The number of new infections is down as well. All involved travelers from overseas.
Well, a closer look now at the situation in China. Infectious disease expert Professor Benjamin Cowling, he is in Hong Kong. He joins us now. Professor Cowling, so no new deaths reported in China from COVID-19, lowering number of cases reported daily, quite an encouraging sign.
Yeah, it's really good news. I think the infections are now down to a very low number in China. Of course, they are having imported infections from Europe, like we've had in Hong Kong, like you've had in Singapore. So we've got to be alert to the start of what could be a second wave. But for now, it's looking good.
Well, China is focusing on counting two subsets of cases now, imported and asymptomatic ones. Should they have started doing this earlier? And how does that add to the sort of complete picture of the outbreak there?
I think in the past, the asymptomatic cases were such a small fraction of all of the infections that it didn't make a lot of difference whether they reported them or not. It wouldn't have changed the numbers by that much. But now we can see there's a lot of asymptomatic cases in China, and so it's really good news that they're reporting these. And I guess as time goes on, maybe some of those will develop symptoms, and they'll also be able to identify the symptomatic cases that go along with asymptomatics.
So saying that, are there fears then of a potential resurgence in the epicenter of Wuhan, especially as the city has started to gradually lift its restrictions?
Yeah, in Wuhan, I think the infections must have come down to a very low level. Nobody's sure whether they really got down all the way to zero. There could still be pockets of infections which are now going to have the chance to spread back out. At the same time, people have come back into China from overseas, some from Europe or the US or elsewhere, bringing infection back. So I'd also suggest to be alert for the start of a second wave in larger cities in China where there's more people coming back in, and that's where infections could really spread, because in Wuhan, I think they're very prepared. In other cities in China, I think they need to be on the alert.
And what would be the drivers or the main things to be concerned about with that scenario that you're describing of another wave coming through?
So we know that there's two ways to reduce transmission or to stop it. One is test and trace, find cases and stop them from spreading, including isolation and quarantine. The other way is social distancing. China's now reopened mostly, stopped most of the social distancing that was in place. So I think the fear is that maybe the test and trace by itself may not be quite enough to stop a second wave, and they may need to bring back some social distancing measures if case numbers do start to rise.
Professor, you mentioned there that, larger cities now need to be a bit more mindful, especially, since Wuhan has, they're starting to travel out again. So do you think these larger cities, are we looking at Beijing, Shanghai, the first-tier cities, do you think they're prepared for this?
I think they need to be doing more testing. I'm sure they are doing a lot of testing, but I think in the first wave, there was a lot of focus on people who'd come from Wuhan, and those were very closely monitored. That was a group of people that could be identified and monitored. But now the authorities in those big cities have to be looking everywhere, because the cases could be cropping up in the community in general. And I think there's quite a number of large cities which would have had importation of infections from people returning from Europe or the US.
Now, China was the first place where this sort of outbreak of COVID-19 broke out. It now seems to be the first country as well to be recovering from it. How far away are we from seeing other countries become like China and sort of see their numbers drop away?
China managed to get their numbers down in Wuhan within about a month, 4 to 6 weeks. They tried really, really hard. They threw absolutely everything at the virus to stop it from spreading. I think it's going to be difficult to see numbers come down that quickly in Europe and in the US. And I guess there could be longer lockdowns in those locations if they go in that direction. I think China really showed the world how effective it can be at controlling the spread of something like COVID. I think now what everybody's looking for is whether their exit strategy works, whether focusing on doing testing without much social distancing will be enough to keep the virus contained.
All right, Mayor, thanks for your thoughts this evening. Professor Benjamin Cowling speaking to us from Hong Kong.